Everybody. My name is Jackie Zimmerman. Hopefully you know who I am at this point. If not, I will be moderating this amazing international roundtable. I'm a long-term UC and J-pouch patient myself, and I am excited to introduce you to some of my friends on this call. Before we dive in though, I wanna let you know that Galley Health, the amazing host of this chat, have a COVID-19 specific feed in the app, which is providing accurate and up-to-date information for IBD patients. So be sure to check it out there before falling down that Twitter rabbit hole that I think we all have been in lately. I was chatting with our friends at Galley Health about some of these conversations I've been having about coronavirus with my friends that are international and about how our different countries are handling things differently, the lockdowns, the quarantines, the grocery shopping. And I thought that it would be really cool to bring us all together to kind of share what it's like in our neck of the woods. So let's do some quick introductions. Tell me who you are, where you're from, and if where you live right now is currently in like a lockdown situation or a shelter in place, and how that's been going. So let's start with Lucy.
Hello, everybody. My name is Lucia Laštíková, and I'm from the Czech Republic. I volunteer as a spokesperson for the Czech Association for Patients with IBD. And to be honest, this is probably the social event of my month, because my country is without 2 days, 1 month under total lockdown.
And where you live right now, like what does lockdown actually mean where you're at?
It means that you're allowed only to walk to work and back home and to do some necessary shopping. Actually, we are a little bit easing down the restrictions, so now we can go for a walk, hike, or I don't know, ride a bicycle. But most of us are working from home offices. Non-essential shops are still shut down. For example, I don't know, if you want to go to the gym, or if you have a appointment at the hairdresser, it's not going to happen for another 14 days at least.
So prior to recently, you weren't even allowed to like take walks outside?
It wasn't recommended. There wasn't a fine. If you need to walk a dog, you can go for sure, but you need to wear a protective mask in public. So basically all the outdoor like training centers were banned, closed, so it wasn't possible to, for example, hike.
Wow. What about you, Joe?
My name's Joe Hinksman. I'm from Vancouver Island in British Columbia, Canada. We're not entirely on lockdown. We just have very strong recommendations that we don't go out unless we absolutely have to. Most non-essential shops, same thing, coffee shops, gyms, social places, that sort of thing are all closed down currently. Essential places are still running. Trucks are still delivering, all that sort of stuff, but we're just under strong recommendation just to stay home. So myself, I'm self-isolating as best I can, and I've got friends and family picking things up for me from the grocery store, that sort of thing.
Joe, do you live alone?
I don't. So I live with my partner. So her and I have just been kind of holed up, trying to keep ourselves busy and entertained. She got laid off as well. So like I work in a mill and they shut down. And then she works at a coffee shop and they shut down. So we're both just waiting for EI, basically.
Got it. What's happening in England, Simon?
So yeah, we're on week 3 of lockdown, our so-called lockdown. It's not been labelled that, but yeah, strict social distancing rules are in place. So most businesses are closed, so it's just the grocery stores and essential places like the pharmacies which are open. And people have been asked to stay at home. There's this slogan: "Stay at home, support the NHS, save lives," and it's very much about trying to keep people in home, going out to grocery shopping as least as possible, going out for one form of exercise per day, and then finally for the key workers to travel to work. So those are like the key things, but we're having problems with people following the social distancing problems. So we've still got groups of people getting together and probably not quite understanding the importance of social distancing, not just for each of us, but for our whole community and for the National Health Service, which is going to be under increasing strain over the coming weeks.
I love that one of your like requirements of staying at home is also, but get out and exercise, because no one else seems to care about that.
Although they keep threatening to say, we'll take the exercise away if you keep not following the rules. But yeah, if people are sensible, you know.
Right. Welcome to the chat, Nicole. If you want to tell us where you're from and what it's like where you live right now. Oh, I can't. Can you guys hear him? We can't hear you. While we try to get his audio working, I have another question kind of related to what we were just talking about with like jobs and government and stuff like that. How is your government reacting financially? Are they offering grants or universal income or one-time payments? Like what's happening where you're at, Lucy?
Well, we have several programs, especially for people running their own businesses, and because they're losing right now. We received European money as well, but so far I don't feel like our government is doing enough because many people are struggling. And I think people are not able to pay rents and loans. And everything is kind of unclear now because the process how to ask for money is quite complicated. So we are receiving new information every day and we are waiting what's going to happen in the future. And to be honest, I'm actually really proud of our nation because people are doing amazing things. They're shopping for elderly people. They're sewing protective masks because our government wasn't able to insure them. You know, NGOs are collecting money. People already donated over 30 million for emergency packets for first responders. So I think people and NGOs are doing more than government, actually.
I feel like it's like that here. I live in the United States. I feel like you can hear that. It's same where I feel like the one thing I've really seen the most of that's been really great is communities helping out individuals. So banding together to make food pantries or grocery store runs for people who can't make it. Since the CDC put out a mask recommendation in the last week, I've just seen tons of people pooling resources to make masks for everybody. So yeah, I feel like on the individual basis, we've been doing really well. I don't know if I would say the same personally on the government basis, but that's probably a chat for another day. Simon, what's happening financially with you guys?
So to be fair, they've been fairly helpful to a point. I think it's just a translation though. So people who are self-isolating and in employment can get statutory sick pay. It's about £94 a week. And that's people in employment and also potentially for some gig workers and zero contract hour workers. For people who are self-employed and other people unable to work, they have opened up our system of universal credit, which is one form of state benefit to help people. But again, it is still quite a small amount, and I think it's opened the eyes to a lot of people about the people who are the lowest on the lowest income in society, and actually how much it is to survive on. But one of the big things they did a couple of weeks ago was to say that they were going to set aside a pot of money to furlough workers. So the idea was we'll furlough employed staff. That was how it started initially, and that the government would cover 80% of salary up to £2,500 per month over a period of 3 months. And I think that was welcomed, but then also there was some backlash from the self-employed community, which I fall under now, as to what do freelancers and people who are self-employed do when they're not got an employer. So the government later came out and said they would do the same process. And so you'd get 80% of your average salary from your tax returns over the last 3 years. up to £2,500 over 3 months. So it's provided some reassurance, but again, those payments won't be coming through until June at the earliest. So there's a period between now and June when people potentially have no income and are having to manage to pay bills and survive, really.
Oh, it's so scary. It's like that here too, where there might be help coming. We think there's help coming, but the way they've structured it is that I think the people who need it the most will actually have to wait the longest to get it, because it's all tied to bank accounts. So if you have a bank account that you used for a tax return, you will get the money through your bank account auto deposited. But if you don't have a bank account, which a lot of under income people living in poverty don't have bank accounts very often, they won't get their money for 5 months. So it's painful to think about how long it could take to see some relief for some people. It looks like we finally have Nikhil back. Are you here?
Can you hear me now?
Yay! So tell us about you. Who are you? Where you're from? What's it like where you live?
So I am Nikhil Jaiswal and I live in Gurugram, India. So it's basically adjacent to the capital city. You must have heard of it, like New Delhi. So Gurugram shares a border with New Delhi. So basically I'm not in the capital, I'm out of the capital, but it's very near to the capital. And right now, India has a nationwide lockdown till April 14th. So all of us are ordered to stay in our homes and only the essential services are running. And so the quarantine has to be followed till April 14th. And right now, there are talks of the lockdown being extended. So we don't really know when this quarantine will be over.
Is your government currently doing anything to help people financially?
Yeah, so there are some packages, but those packages are for the migrants and people who are living below the poverty line. For other people, for the people working in private companies, there has been no relief from the government, and some of the companies are also doing salary cuts, and some are not doing. So it's really up to the company. But most of the relief is aimed towards poor people because this is the hardest for them. So a lot of migrant workers are jobless now, and they don't have money to feed themselves. And most of them are migrating towards their homes. So they are leaving the capitals, they are leaving the big cities, and because they are not finding any work, so it's difficult for them to get to feed themselves. So most of the government support is towards them only.
Right now, with the migrant workers, are they helping them financially? Are they providing like food pantries or?
The government is also providing food, I think, and these workers, they have the government is putting, I think, 500 per month. There's some amount for each category of people, and every month the government is putting some money into their accounts. So the government is doing both financially and actually also the government is providing them food and other things also, like cooking essentials and all those stuff. So yeah.
Isn't it bananas that this is happening everywhere? Like when you think of this, it's everywhere. Joe, what is Canada doing to help people financially?
So Canada's got a few things going on for people who are employed and who have been affected by the COVID that aren't able to work because of it in any shape or fashion. So, they can apply for EI, and if they qualify for that, they'll get that. And then if you don't qualify for employment insurance benefits, they actually have a Canadian emergency response benefit that everybody qualifies for. So they'll just give you $500 a week in a lump sum. So they give you $2,000 for the month, and then next month we'll see what happens, and you may have to apply for it again. So I can only really speak for myself, but I do know that for someone like myself who's out of work because of this pandemic, I know my bills are paid, and I know that I'm going to be able to feed myself, right? And there's also tax credits that every Canadian who above the age of majority qualifies for, right? So they are helping out quite a bit that way. Then, of course, as far as healthcare is concerned, they're helping out with, the same usual benefits we get as far as everybody, depending on your income, make sure everybody has their meds, make sure everybody has their medical supplies that they need, and that sort of thing. So far, I feel like our government has really come together and is helping people out from what I can tell. I know for myself, it's been beneficial. And then we have financial institutions as well. So like financial institutions that carry our mortgages and our car loans and our regular loans and all that sort of stuff are allowing us to defer mortgage payments and defer loan payments. And, so we can relieve ourselves from having to pay those things for a period of time until something changes, right? But everything's changing every day. So, it's a pretty fluid situation over here.
You talked about medication, and let's talk about that for a minute, because that's kind of what makes this chat, unique. We live everywhere, but also we're all patients. And I've been following IBD recommendations pretty heavily on Twitter. There's a lot of really good IBD docs there talking about what's going on with IBD patients in terms of, their likelihood of getting coronavirus, or if they do, what happens. What's your doctor or your infusion center, or like what's happening where you're at in terms of being specifically an IBD patient? Are they telling you to change anything in your life or your protocols?
Yes.
Yeah.
So on my end, like I'm on Stelara, which is an immunosuppressant medication, right? So I have strong recommendations from, we have Crohn's and Colitis Canada as a website that's releasing daily information, kind of giving us guidance on what we should be doing. So I'm moderate risk, right? I'm not severe, but because I self-administer an immunosuppressant, what they've done is instead of me going to the clinic to pick it up, they're actually just mailing it to my front door, right? So I get my medication right to my house. And then as far as the pharmacy is concerned, because everything is so crazy, I still have to go there to pick up my meds. But what they've done for me is they've actually filled my prescriptions. Like one of them was expired. And what they did was they actually just filled it anyways as a response to them knowing that people can't get in to see their doctors the same way we could before. So, I know for myself, my medications and everything have been pretty available.
That's amazing. What's it like for you, Lucy?
Well, we are working with medical specialists in our country really closely, not only with GIs, but also with psychiatrists. And we prepared basic 10 steps for our patients to follow. And I think the most crucial one is the step number 1, do not stop your medication. Because so far there is no proven connection with IBD and COVID-19. And I think there is a bigger danger for you if you flare and you need to go to the hospital, and there is a possibility you will catch something. So please do not lower your doses, do not change your medication unless your doctor tells you to do so.
Nikhil, is that what they're telling you too?
So actually, I think India is lacking in this area. So what is happening here is there are no recommendations from the government or from the doctors about what to do about our medication. So all of the healthcare system is right now focused on the COVID patients only. And in India, not a lot of doctors are on social media or are accessible apart from appointments. So there have really been no guidelines for IBD patients, or for that matter, like any other patients also. So what we are doing is we are just following the doctors from the West and other countries who are sharing advice on Twitter and Facebook and stuff. And even for the medicines, like there is no system to ensure that we get our medicines on time. And the infusions in India, they happen in the hospitals only. There are no separate centers or like clinics where you can go to get an infusion. So that is also a problem, because public transportation is limited to essential workers only. So unless you have a personal transport, you can't get to the infusion center. So I'm right now not on any immunosuppressant like Remicade, or so I don't have to get an infusion. So right now I'm okay, but I don't know how my other friends are doing. Most probably they would have postponed their infusions, or yeah. And the government is trying to make medicines available. So, but what is happening is there is a communication gap between the central government and the state government and the authorities. So the deliveries are taking time. Some deliveries are getting cancelled. So we are facing some problems in that aspect. So there's not a lot of guidance in this area.
So it sounds like the patients are kind of in the dark right now. There's not a lot.
We are in the dark actively.
you can't get to your infusion, sorry, nothing to do. Like if you can't get there, we also have no recommendations about what to do to stay healthy.
Contact the doctors even. So there's no hotline or helpline to contact the doctors for IBD patients. So
are they doing telehealth there? Are you guys allowed to do that?
We are allowed to do, but I think it's more like the usual commercial system. Like there might be doctors available, they'll charge fees, and the doctors that work in the public healthcare system, they are not available via video conferencing, or their appointments are not available. All the outpatient departments have been closed, so we can't even visit the hospitals to get an appointment. So right now, if you have an emergency, you go to the hospital and get admitted like a regular patient. So otherwise, you just stay at home and do what you can do best.
So I want to hear from Simon about what's happening in England, but I have a little offshoot question based on what you just said. We've had people asking about, like, how do you keep your mental health together during quarantine, and how do you handle the stress? And I kind of want to shoot that right back to you, Nikhil, because with no help from your doctors, you can't access them. Your medication might be up in the air. I mean, what are you doing? I know you're not on meds, but what are you doing, or what are your friends doing to like keep it together right now?
Right now, we are communicating a lot in amongst ourselves. So whatever information we are getting from other sources, anything on social media, we are just sharing amongst ourselves. And I would say that we are very constrained in this area. Like we can't do a lot. So because we are literally blind, there's no guidance and there's no place we can go to help, go to get some help. And one of my friends, he's on Azoran. It's an immunosuppressant drug. So, and he goes to a bank. So he's an essential worker. He has to go to the bank. He has IBD. He has hemophilia. He has AVN, but he still has to go to the bank. He has to work. So there is no there's no help from the government or from the doctor's side for us. So that is stressful, and definitely we are a bit scared. So many of my friends are scared, like what happens if we get COVID? Because we have pre-existing conditions and our healthcare system is already burdened. So what will happen to us? That is a matter of stress. So right now we are just like talking to each other and trying to take it in a light manner. So cracking jokes and stuff, and trying to right now we are just trying to build a community, and we are just sharing information and trying to do our best to keep it together.
Wow. It's still so bizarre to me that we're all in this together, but yet we're still handling things really, really differently. Like each government, and even here in the States, each state is handling things differently.
Yeah, the same thing is happening in India also. Every state has different direction, and the central government has different directions. So yeah, there's a lot of variation in the way different people are handling this situation.
What about you, Simon? Are the doctors giving you guys attention right now?
So I actually put a post out to on one of our patient forums yesterday on Facebook. I mean, for me, I self-inject, so I don't need to go to hospital. So I've got my supply. They came into delivery last week, which was really bizarre because we had this thing where he knocked on the door, stood away, said he'll put the things down, and it took about 10 minutes to get the medication across. But so that's fine, and I'm doing reasonably okay at the moment. So so I wanted to see what it was like for other people. So I mean, my team haven't contacted me, but I know all routine outpatient appointments have been cancelled, but infusions are still going ahead. So I asked people just for their experiences, really. Some people said not many things had changed, so they were going on to the infusion ward, and there was maybe a little bit more. They were asking people to wash their hands and just a few little bits where it was a bit more stringent. But then somebody else came back and said they got to the centre, they was told to wait in the car, that the reception would ring them when they wanted them to come in. They came in, they had the temperature screened, the staff were wearing the protective equipment, the PPE, and it was very sort of protocol and rigid. So, I mean, it seems to be depending a little bit on where people are going to, which hospital trust. But infusions are still going ahead, which I think is the main thing, although there is that anxiety around I'm going to a centre where there will be COVID-19 patients, and that anxiety with that for people, I can only just imagine, because I know you have that anxiety when you step outside the door, and that's something I'm not doing now. But you used to get that when you went to the grocery store. So it's a big part of the experience. But it's good to hear that people are still getting access to the treatment, which is vital, really. Although I know they've started to try and switch some people over from infusion to subcut injections if they can, depending on what treatment they're on.
Are they offering any home infusions? Is that an option anywhere?
Not that I'm aware of. They do home infusions for very rare cases, but the teams are usually quite small. The IV therapy team at home, so you usually struggle to get even that in palliative care sometimes. So I suspect they're just going to be so overwhelmed that it's not going to be routine for probably people with IBD.
Oh, I don't know how. I feel like depending on who you know in the States, whatever state they're in is probably wildly different. And I've heard everything from business as usual to only home infusions to we've shut the infusion center down and you're all out of luck. So it's bananas how everything is handled so differently. And I'm wondering about the long-term outcomes too of weird care where you either don't have it or maybe it's not on time, or how we all end up dealing with this later on, the after effects if you weren't able to get access when you needed it most. Joe, we talked about mental health on a roundtable a couple months ago, and I think you're a good dude to talk about mental health, and I think a lot of people are asking about this, specifically being quarantined. You mentioned that you have been laid off from your job. How are you handling stress, and what are you doing to still be able to take on the day?
Well, I find a lot of the time I don't really have a day to take on. I'm at home. We don't have a whole lot on the go. And as far as my mental health is concerned, I'm just trying not to sweat the small stuff and just keep a semblance of a routine that I was doing before, right? Like I still get up at the same time in the morning. I do my meditation. I do my little prayers. I do my things that I normally do. And, a few things maybe aren't the best coping mechanisms. Like we've been putting some serious miles on the Xbox, right? And stuff like that. But, I've got a patio in the back. I've been getting some exercise. I've been making sure to lay out in the sun and get some time with my feet on the grass and that sort of stuff. Because, as far as I'm concerned, there's not really much of a point, I guess, in being too nervous or too worrisome about the outcome of all of this, because at the end of the day, I can only control what I can control. And in my world, my focus is keeping me and my partner safe, healthy, fed, right? If we got a roof over our head, and I'm just grateful to have those things taken care of. So I just try my best to go through my day, reminding myself I have a lot to be grateful for instead of worrying about, what's going on out there, which can definitely create some anxiety if I dip into that area too much,
Do you find that in your specific situation, I know that the world is crumbling out there, but you've mentioned you've got food, you've got shelter, your bills are going to be paid. Is any part of this relaxing, at all?
I think so.
Really?
I mean, when we're hanging out, playing video games or watching movies, or I'm doing stuff on the computer, when I'm writing or doing anything like that, there is this little piece of me in the back of my mind that's kind of enjoying the lack of responsibility, right? It kind of feels like I'm on vacation. How long that feeling's going to last, I don't know. I'm sure it'll come crashing down at some point. But so far it's been, I'm just trying my best to enjoy my little staycation at home.
I know it's the staycation we all said we wanted, except with none of the terms that we requested.
Yeah, exactly.
It's an actual staycation. Do not leave the house. The next question I have is about resources. I know some of you have mentioned your local Crohn's and Colitis Foundation or organization, some stuff from the NHS, maybe from Simon, but where are you getting your information? I know that, like, Nikhil, you mentioned you're not getting information. And you guys are kind of going to Twitter and kind of Western meds, but are any of you guys getting information from non-government sources?
No, like there's no IBD specific information for us. So we are not really getting any information from anywhere, any source that's in India. So most of our information is based off of I mean, there are some videos that there's some general advice that doctors are given to patients in the clinics. So there are videos of that which are being shared, but there's no really IBD specific information that we can follow, or how should we take our meds, should we stop them, should we continue them. So there's really no IBD specific information for us from any source. Like no doctor or any not even privately funded hospital, they are they are giving us the information. So everybody's, I think, really focusing on COVID, and I don't think they are focusing on anything else.
Yeah. Simon, is there any other like go-to information spots right now for you, or even anybody you know in the world? Like, where are people going for information?
I mean, through us, there's a government website, NHS. There's just so much information, and I think that's one of the things that, like in the IBD world, but also in the rheumatology world, with my background with arthritis, there's lots of different information. I know it was getting a little bit confusing, so we've got our professional societies, so like the British Society of Rheumatology and British Society of Gastroenterology. They've given some guidance because there's a lot of confusion around: should I be shielding, as in not having any contact? Should I be really extreme in terms of social distancing? So likes of Crohn's and Colitis UK have pulled together some really good information. But I think it's a challenge in that there is so much information, and people are all giving their own ideas and thoughts, that it can be quite confusing as to actually where do we stand. And likes of BBC and those sort of trusted information for the generic stuff are important, but people are wanting this condition specific information that's backed up by professional advice. And you have seen the odd doctor coming on giving a comment on the news, or commenting on Twitter, and I think sometimes that's not always helps if different clinicians have got a different perspective. So yeah, it can be quite challenging to find your way through what's facts and what's fiction.
Are you finding that you're going to, like, not other governments, but like resources in other countries for information, like, the American doctors on Twitter, or is everybody kind of like sticking in their bubbles because things are different wherever you're at right now?
For me, that's the case anyway. I'm following the UK things, but then it's also interesting seeing what's happening in other countries. And I know we've got a few different WhatsApp groups with other patients we've been on different committees with, and it's just interesting to see where we are behind. And that was relevant when Italy were a few weeks ahead of us, and things that we might want to be think about.
I think Lucy's having some sound problems.
Okay,
I've got a few
She can hear us.
words on the topic.
Yeah, Joe.
Is their sound still off?
No, I think it works now, but if you have a comment.
Yeah, I was just going to say, like, we have a really awesome resource. It's just crohnsandcolitis.ca. And they're offering like really succinct, really direct information specific to IBD patients. And they also have bi-weekly webinars with gastroenterologists who are just answering questions about, what's going on and ways to, cope with everything. And they even have like ways to cope with stress, ways to cope with anxiety, all of these resources all on this one website. So I would recommend to anybody who doesn't have access to resources like that, hop onto that website and check it out. You'll probably find a lot of information that could be helpful.
Yeah, we did on Galley Health, we did an interview with Dr. Nandi, who's a GI out of Pennsylvania, who is lovely. And we did a lot of, we took questions from social to ask. So if you, again, are somebody who does not have access to resources and has a lot of some of these basic questions that were, am I at risk? Do I take my medication? That kind of stuff. I would recommend that. That's on their Facebook page and it's on their YouTube page to definitely check that out. Lucy, you're back.
Yeah, finally.
So I can't remember now where we left off, but where are you going for information right now?
So we have special web page since the beginning, and also we have a phone app. Ministry of Health is running it, and they're doing pretty good job. They're fighting the horses, trying to avoid the panic. And also we as a patient association, we received informative leaflets. So we're now distributing to the patients. We have videos, and I think public also received leaflets into their post boxes. So I think people are well informed. Media are covering the story maybe too much for my taste, but everything is kind of relevant.
What are infusion and medication practices still the same? Or are people still going to infusion centers and seeing doctors if they need to?
Well, actually, we didn't have enough protective gear, so some biological centers were closed for a few days. And right now we are practicing social distancing. Patients are asked to come on a certain time. And, all the places have plenty of disinfects, and you need to use gloves. So I think it's pretty safe. And if you inject yourself at home, you probably get a bench,
Yeah. So I want to pivot, related but unrelated. I want to talk about the grocery store. Mostly because, so every country, if you've ever gone shopping in a grocery store in a country that you don't live in, they're all pretty different, even though we're all there for the same stuff. But here we're seeing early morning hours available for senior citizens or the immunocompromised. We're seeing people wait outside. They're only allowed to have 50% of capacity in the store. And it's still, do you guys remember the show Supermarket Sweep? Did you have that show?
Oh, yeah.
You did? Okay, so Supermarket Sweep was a show, it was a game show, and they basically would put a timer on and people would take carts and they would run through the store to get as many items as they can at high value, and then that was the whole point of the show. But I bring it up because I felt like I was in Supermarket Sweep last week when we went to the grocery store. We went very early. It was mostly the elderly and some other people like myself and my husband. But it felt like a mad dash to get to the meat, to get to the dairy products, or some of the things that are paper products were already gone by the time we got there. But what is the experience in the grocery store like where you're at? Joe?
So I'm not currently going to the grocery store. We have, we either go there and they deliver it out to our vehicle, or I have friends and family going for me. But from what I understand, after that whole toilet paper fiasco kind of calmed down a little bit, we've been able to pretty well get anything that we need. Meat's out once in a while and that sort of thing, but for the most part, I don't think we're having a whole lot of issues keeping the shelves stocked on this end.
Are they offering special hours for people?
I'm not sure. I've read about it online. I'm not sure if we're doing it here or not, because I just haven't been out there to see that. So I'm just not sure.
What about you, Simon?
Yeah, it's calmed down a little bit. I think initially, and just before the lockdown 3 weeks ago, it was chaos. There was no toilet rolls, no kitchen rolls, just the most bizarre things which ran out. This is it's not one of those conditions, but it was just a bit pandemonium, and the supermarkets ended up restricting items, so it was 4, 3, sometimes 2 or 1 item of milk, and sort of those essential things, and they've set aside time. No, I think it's really good. They've set aside time for key workers, in particular the National Health Service workers, because there's some heartbreaking videos of staff after coming off 15, 16-hour shifts, trying to get to the supermarket, and there's nothing left. And there was one nurse who broke down on one of the aisles in the supermarket because there was just nothing, and she was just at the end of the tether. And I think that made a lot of people think, we need to protect ours for them and protect ours for the elderly and vulnerable. I did go during one of those morning hours for the elderly and vulnerable and got some really dirty looks because the average age was 70 plus, and then I turn up with my biologic card saying I'm on a biologic drug, but you still get those looks. But no, it seems to settle down much more now, and people, the stock's replenished. You know, they're trying to get people to observe the 6 foot rule, which is not always easy because people just keep forgetting. But things I think have settled down to what they were a couple of weeks ago.
I had somebody confront us at the grocery store as well with a very snarky, "You don't look over 60," which I've never seen my husband jump into like a grizzly bear faster than in that moment, which was kind of amazing because he's kind of a teddy bear most of the time. Speaking of grocery stores, what about managing diet, like IBD specific diet stuff? Because things are out, they're hard to find, or maybe what you're normally used to eating that keeps you feeling well, you can't get your hands on. Nikhil, have you experienced anything like this, or your grocery store is cool, or what's happening?
No, I am not on any like special diet per se, and I only avoid things with skins and seeds. So I'm very good in the diet area. So right now I haven't had to face any issues like with the diet. But the lockdown was announced like 4 hours before the lockdown. The PM announced the lockdown at 8 o'clock. And the lockdown was scheduled to start at 12 o'clock. So there was only 4 hours for people to get all the stuff. And there were a lot of lines and, huge crowds in front of some stores. Right now, where I am, we are mainly depending on online deliveries. And in the initial few days, there was a lot of chaos, and there were a lot of problems also because, the Indian staple, that is rice and pulses, and they were all out of stock. So we were literally, staying on, like checking 4 grocery apps, and checking which thing is available, which is in stock on which app, and we are just trying to get it first. So it was really a rush for the first few days, and still now we are just getting all our deliveries online only, and we keep checking those apps like what is available and what we can buy. And the people who have the finances, obviously they like stock for people have been stocking for like 3 months. I know some people who stock up for 3 months. So, and the problem is it creates a problem for the people who don't have that capacity to buy so much of, the stock will run out. And some shopkeepers, they are acting a bit logically, like they are not letting people buy all that stuff at once. So so right now it's okay. So we are handling it fine. But yes, people have been having problems with the groceries, and problem is the trucks, the transport that bring all these bring all these foods and vegetables into the states. They are facing problems at the borders. So many trucks have been like halted at the borders, and too many staples and even milk, like it got wasted because there was not this communication, like what is essential and what is not essential. Like the cops on the street, they don't know what the government directives are as well. Like they are not very well versed with the directives. So that caused a lot of problems in the initial days. Right now, I think it's a bit better, and right now we are doing fine. So now it is a bit better than before.
Lucy, do you have any like diet restrictions or anything normally that you've had to manage throughout this?
No, I eat everything, and when it comes to our stores, we are pretty good. But food is pretty much, we have all we need. The same with toilet paper. It was a little bit crazy mid-March when people were trying to hoard things because they had no idea what's going to happen. But right now, I think we are still short with protective masks and respirators, thermometers. I believe there was a short outage for paracetamol as well because it was recommended, but rest of the supplies is pretty good.
Does anybody else think it's super kind of funny that the thing that everybody panicked about was toilet paper? Because for me, like as an IBD patient, well, one, we have a bidet, so we were like totally cool. But I was shocked. I was like, none of you people really need this stuff. And I have been concerned actually about our fellow IBD people who really may have been in a tough bind a couple of times, but it was just such a bizarre thing that everybody panicked about. And I didn't know any IBD patients personally who were panicked about this situation. And I kind of wish we could have put out like a PSA that was like, hey, everybody calm down. As somebody who is an expert in toilet paper, maybe calm down a little bit.
Yeah, I mean, me and Sage just had a regular person amount of toilet paper in our house when this whole thing started. we waited it out. We didn't run out of toilet paper when we needed some. We went and got some, another regular person amount of toilet paper. And you know, it boggles my mind that what, you know, one of my buddies said that he came home and his wife was stocking his closet with like $600 worth of toilet paper. Right? He said that he almost divorced her on the spot. Right? So, you know, it's such a bizarre phenomenon, that one, right? Like we got funny looks coming out of the grocery store with just like a little 12-pack of toilet paper, right? And I don't know what else to say about that. It's crazy.
I saw a store somewhere that also said no returns either. So if you bought $600 worth of toilet paper, you're now stuck with it.
Yeah, pass it down to the grandkids.
Right. Simon, what's the toilet paper situation like over there?
It's normal. It's gone back to normal now. But a couple of weeks ago, before the lockdown, it was just really frustrating because every time I went to the supermarket, there was just none left, and I just got really frustrated, thinking, "You people probably don't even need it." And so we were running really short, which was a bit panicky. But it's back in stock now, even though it's just down to 2 packs per person. So I think that was a sort of being lifted now. But yeah, it's just crazy how that's always the first thing people go for. It was like, I'm going to have to go to newspaper if we don't have any of this.
Well, and we keep running out of produce because, it only lasts so long, and then you have to go back and trying to go back. But my first concern was at no point ever toilet paper, which I think maybe says a lot for how far I've come in my IBD journey personally. But I also think that it just shows like what mob mentality does, where people are like, yes, paper products, must have paper products.
Hello.
So bizarre. We're getting about to the end of our time here, you guys, but we have one question from the viewers that I want to shoot to you. It's, how responsive are your doctors? Are you having trouble getting med refills if docs aren't available? Or if any of you are ostomates or ostomates, has anybody had any trouble with either contacting their doctor or getting a refill on anything?
So I have an ostomy, so I am having problems with that. So because I used to get my ostomy products from my hospital, so it's in the capital, and I can't go to the capital right now because there's checking at the borders and everything. So I was in really a short supply of bags. So luckily before the lockdown, I went and got some bags, but they are really not enough. I didn't anticipate such a long period of lockdown. So right now I'm thinking how to get my bags, and I am right now hunting for people that will courier the bags to me, because in India getting the bags is also a big problem. Like there are only 2-3 companies who ship the bags. So yeah, it's a problem.
That's heartbreaking. And do you have access to like nurses that might have access to, or everybody is just purely focused on COVID-19 right now?
Yeah, everybody is just focused on COVID-19, and we are like on our own, and we are just like trying to figure out, there are some private suppliers who will supply the bags. And even then, the people who have more money and they buy those stuff. Like I know people who are thinking of buying 1 year worth of bags, like bags for 1 year. They're thinking of buying all that at once. So that is like crazy. And if they do all that, like, they want to be bags for us, for the patients. So that is also a problem, how to tell people that don't panic and let others, also have that stuff. It is important for everybody.
Yeah. The underlying panic of all of this, it finds its way in everything, right? It's the toilet paper.
Yeah,
it's
I think people are, not reacting logically. So, and I think like if people have not been inside the healthcare system, maybe that is the reason why. Like some people don't have any idea, so they might be taking it out of proportions. Like they might be thinking that it's like the world is going to end tomorrow, and what happens if I don't have this? What happens if I don't have that? So maybe that's why. So everybody's like focusing on themselves and like not really thinking about what effect their actions are having on other people.
So maybe this is just me, but do any of you feel just a little bit like the rest of the world can now be like, see, we told you this system was not a great system. Wherever the holes are in medical system, or even like Simon mentioned earlier, you know, getting supplies down to people who are living below the poverty line, you know, there's this teeny tiny part of me that's a little bit of like, I told you so, to all the healthy people in the world. And it feels bad. I don't feel good about feeling that way, but it feels real that, you know, people in chronic illness communities or disability communities, or people who have been living in poverty, we've been talking about a lot of these core issues for a very long time. And it feels like nobody has listened. And now it's like everybody's experiencing it. And I think you're right. That's where a lot of the panic comes in, is they're not used to dealing with some of the like, medical neglect, we'll call it.
Yeah. Yeah, and especially India is a very low percentage of like India spends a very low percentage of its GDP on healthcare, and the you know, chronic illness patients and the poor people, they are very neglected, and for a long time, like nobody, the government is not very like inclined on putting money in that sector. So most of the money is going towards defense and all that stuff, and even after like even if you no, people don't really understand the importance of investing in the healthcare sector. So I hope that I just hope that after all this, people understand that, you know, the basic foundations, you know, you have to get that correct first. Then only you can it's better to fix your healthcare systems, fix your education, and, you know, get everybody to a basic level of, you know, where everybody can access, you know, certain like everybody has food, everybody has shelter, everybody has healthcare. And then we can focus on, you know, growing in other directions. So I just hope people learn the importance of, you know, investing in healthcare and research and, you know, doctors, nurses, all that.
I think that's a really great way for us to kind of wrap up this call, is maybe talking about kind of what we hope happens at the end of this. Simon, do you have any profound hopes for when all this is over?
I think it's opened people's eyes to what life is like when your life depends on a health service, and I think that's opened people's eyes here, and realize what people actually have to go through. And do you know what? It's not nice sometimes being told you have to do this, and this is a reality for people. So there's been a lot more appreciation, I think, for that, and I hope that continues, and appreciation for the health service. I know in an hour's time at 8 p.m. UK we do a weekly clap for carers, and that's really to cover everybody working in the health service and all the key workers, to recognise what they do, because I think it's now we've realised actually who are the people who actually make our country work and be so fantastic. So I hope that continues moving forward, and just this general more appreciation and a more empathetic understanding for what it's like for people going through difficulties, whatever they may be.
I agree. Lucy, what do you hope for?
I hope it will, you know, change the society completely, because right now we are facing really big problems, and it makes your perspective quite different, not only for the healthy people, for the ill people as well. And I hope people will appreciate more what they have, and they will appreciate the work others are doing for them.
Joe, bring us home.
You know what they said. I think they summed it up really well, that it, you know, I think it'll be a benefit to, you know, have more people other than the ones who have kind of lived at the mercy of our medical systems, right? Like for us, this is a full-time thing. And the processes that we have to go through to get treatment, to get meds, to get diagnostics, to get all that different stuff, supplies, right? It's always such a runaround, right? So, you know, we have other people getting, you know, not getting to, but experiencing the difficulties of being in mercy of the medical system and restrictions on what you can and can't do in your day-to-day, you know. And like everyone else has said, hopefully that shifts the spotlight a little bit into areas where it needs to be.
Well, I have nothing to add. I hope all of those things as well. And Joe, Lucy, Simon, Nikhil, thank you. I know we're all on weird time zone things happening, so I appreciate you taking your time, whether it's your morning or your evening, to be with us today. And thanking our friends at Galley Health for hosting this again. It's was really helpful for me to hear about what people were doing in other countries in the beginning. So I hope it's been helpful for everybody listening. And as a reminder, don't forget that Galley Health does have that COVID-19 specific feed in their app. So if you're looking for resources or some of the things maybe we talked about today, definitely check there. And until next time, stay home, stay safe. See you, everybody.
Bye.
Bye. Bye.